As we age, our bodies go through subtle but profound transformations. Many of these changes are visible: graying hair, slower recovery times, changes in posture, but others are invisible and happen at the cellular and metabolic levels. Among these less obvious shifts is a gradual decline in the body's ability to absorb, produce, and utilize essential nutrients. And one of the most important nutrients affected by this change is vitamin D. Often called the sunshine vitamin, vitamin D plays a crucial role in bone health, immune regulation, and even cellular aging. It supports calcium absorption, regulates inflammation, and helps maintain the integrity of tissues throughout the body. But here's the catch. As we get older, our natural ability to maintain adequate vitamin D levels declines sharply, just when we may need this nutrient the most. One of the most significant age-related shifts occurs in the skin. In younger people, exposure to sunlight, specifically ultraviolet B, UVB, radiation, triggers the skin to synthesize vitamin D3 from cholesterol. But by the time someone reaches their 60s or 70s, their skin has lost much of its efficiency in this process, producing as much as 50% to 75% less vitamin D under the same sunlight exposure as a younger person. This decline happens regardless of lifestyle and is a natural consequence of skin thinning and reduced 7-dehydrocholesterol levels. But the reduction doesn't stop there. The liver and kidneys, which are responsible for converting vitamin D into its active form, calcitriol, also undergo age-related changes. Liver function may be less efficient at hydroxylating vitamin D, and kidney function, especially in those with chronic conditions, declines with age, impairing the final step in activation. As a result, even if older adults get sufficient sun or dietary vitamin D, their bodies may not be able to fully convert and utilize it. On top of that, aging often brings changes in gastrointestinal function. Many seniors experience lower stomach acid levels, decreased enzyme secretion, and altered gut microbiota, factors that can interfere with the absorption of fat-soluble vitamins like vitamin D. Those with digestive disorders such as celiac disease, Crohn's disease, or a history of bariatric surgery are at even higher risk. Compounding all of this is the fact that older adults often spend less time outdoors, whether due to mobility issues, reduced social engagement, or climate. When they do go outside, they may wear more protective clothing or sunscreen, which, while important for skin cancer prevention, further reduces vitamin D synthesis. In nursing homes or assisted living facilities, daily sunlight exposure may be minimal, sometimes amounting to just minutes per day, if at all. These biological and lifestyle factors converge to make vitamin D deficiency incredibly common among seniors. Studies estimate that up to 70% of older adults have suboptimal vitamin D levels, particularly those living in northern latitudes or institutional settings. And the consequences are not limited to bone health. Low vitamin D status in older adults has been linked to increased risk of osteoporosis and fractures, greater susceptibility to respiratory infections, and immune decline, higher rates of chronic inflammation, potential acceleration of telomere shortening, a key marker of biological aging, cognitive issues and depressive symptoms, muscle weakness, and increased fall risk. All of this raises a vital question. Do older adults need more vitamin D than younger people? The answer, increasingly supported by research, appears to be yes. While the standard daily recommendation for adults has traditionally hovered around 600 to 800 IU, many experts now argue this is insufficient for older populations, especially those with limited sun exposure or known risk factors. Instead, an intake of 1,000 to 2,000 IU of vitamin D3 per day is now commonly recommended for adults over 60. In some cases, particularly in those with very low blood levels or poor absorption, higher therapeutic doses may be needed under medical supervision. The goal isn't just to meet a number, but to reach optimal blood concentrations of 25-hydroxyvitamin D, typically considered to be at least 30 nanograms per milliliter, with many researchers suggesting a more protective range of 40 to 60 nanograms per milliliter for older adults. Regular testing can help tailor supplementation to individual needs. The good news is that vitamin D supplementation is safe, affordable, and easy to implement. Unlike many medications, it has few side effects when taken within recommended limits. Moreover, it offers benefits that extend far beyond bones. helping to regulate the immune system, preserve cognitive function, support muscle strength, and possibly even delay some hallmarks of biological aging, including telomere shortening and DNA damage. In a time when aging populations face growing risks of frailty, chronic disease, and reduced quality of life, vitamin D stands out as a simple yet powerful tool for supporting long-term health. It isn't a miracle cure, but it is a foundational piece of the puzzle, one that becomes even more important with each passing decade. In summary, aging significantly reduces the body's ability to make and use vitamin D just when the demand for its protective functions increases. Recognizing this gap and responding with proactive supplementation and monitoring is a critical step in helping older adults maintain vitality, independence, and resilience at the cellular level.